Fibromyalgia. What is it? What causes it? Who gets it and why? Hi, I'm Dr. Rodger Murphree, and for over 2 decades, I've specialized in treating fibromyalgia patients around the world. There's still quite a bit of confusion, misunderstanding about fibromyalgia. And I'd like to share some information with you, hoping to help to clear that out, maybe for you or a spouse or maybe a family member or coworker that really didn't understand what you're going through. But fibromyalgia is a syndrome. A syndrome is a group of symptoms that people have in common, and we give it a name. Irritable bowel syndrome is bloating, gas, loose bowel movements, constipation, stomach pain. That's called irritable bowel syndrome. Those symptoms that I just mentioned are the things that people with irritable bowel experience. With fibromyalgia, the common symptoms are diffuse, achy, sometimes disabling pain, exhaustion, restless leg syndrome, poor sleep, irritable bowel syndrome, anxiety, depression. These are things that we see are commonly experienced in the fibromyalgia community. Fibromyalgia affects women primarily. About 95% of people who have fibromyalgia are women. It's less than probably 6% of the world population, but it's still a considerable amount of people walking around with this thing called fibromyalgia. It typically affects women between the ages of 30 and 65. And it's something that once you experience it, unfortunately, rarely do you get over it without some help. It is brought on by stress. Now, a lot of times I'll share that in a doctor's continuing ed lecture, and I'll get kind of this odd look, or even sometimes I'll share it in a support group meeting, and some of the members who have fibromyalgia will initially disagree until they realize what I'm talking about. When I'm talking about stress, I'm not talking about the stress that you might experience, tough day at work, or maybe a long weekend working out in the yard, or maybe an argument that you have with your disgruntled teenager. I'm talking about stress that really takes a toll on you and creates the environment for fibromyalgia to take hold. And this stress can be something that you were exposed to even in childhood, because we know that those with fibromyalgia often have had a very stressful childhood. It could be some type of an abuse situation. It could be frequent moving. It could be just a toxic household. It could be that they had an illness. But getting under that stress as an adolescent or as a young child, they lose their plasticity, their ability to rebound to stress. So as they go through life, they encounter something that's the straw that breaks the camel's back. Now, you could have had a great childhood, but it's still the same mechanism. Something comes along that's incredibly stressful, and the body's not able to help you overcome it. And that could be the loss of a loved one. It could be a divorce. It could be post-surgery, something you had, you had a surgical condition. It could be an illness that you had and you just never got over. It could be an accident. It could be some type of trauma, which is something that weaves its way through many of my patients, some past trauma. It could be something that's long-term stress, a toxic work environment, a toxic home environment, or it could be something that is an acute stressor. Like I said, like a post-surgery or a car accident that brings on fibromyalgia. And the first symptoms oftentimes are just kind of diffuse, achy kind of pain that just doesn't go away no matter what you do. Taking over-the-counter non-steroidal anti-inflammatories, ibuprofen, Advil, these type of things really doesn't give you any relief. And what we see is as this condition starts to manifest itself, the thing that really adds gasoline to the fire of fibromyalgia is poor sleep. And that's really the common denominator. I mean, fibromyalgia sometimes is a waste paper basket diagnosis. It's a process of elimination. That's how you get diagnosed. Typically, you go to your doctor and you share your symptoms of the pain, the fatigue, the poor sleep, the irritable bowel, the gut issues. They do testing. The labs come back typically normal, and they either go ahead and tell you, oh, we think you got fibromyalgia, or maybe they refer you to a rheumatologist, and your symptoms sound a lot like an autoimmune disease, like rheumatoid arthritis or Sjogren's or lupus. The labs come back, they're all normal, and the rheumatologist says, I think you have fibromyalgia. Here's some medication. Come back and see me in 6 months. Now, sometimes what you hear is, and you're hearing this more and more often, is that we don't treat fibromyalgia when you try to get an appointment with a rheumatologist. The reason that is that traditional medicine alone, drug therapy alone, is a dead end for fibromyalgia. The surveys show this. They show over a 15-year period, when you survey someone over a 15-year period, and they're using common prescription medications to treat their fibromyalgia, whether that's Lyrica, Grillis, Neurontin, gabapentin, Civilla, Cymbalta, Ambien, Trazodone, Valium, Klonopin, whatever it is. There's a lot of common drugs used to treat fibromyalgia, but unfortunately, those drugs are treating symptoms and not the underlying causes. So rarely do people find that long-term they're getting any kind of benefit from these prescription medications. And unfortunately, because there's so many symptoms associated with fibromyalgia, everybody's fibromyalgia is a little bit different, but they're common symptoms, as I mentioned earlier. In the traditional medical world, it's about treating the symptoms with a drug and getting those symptoms to come down. If you have high blood pressure, we would put you on blood pressure medication. If you had high blood sugar, we'd put you on diabetes medication. If you have fibromyalgia, though, you've got numerous symptoms. And if you're not careful, you wind up being on half a dozen to a dozen drugs, with every doctor that you go to, every new specialist recommending some new drug, trying to be helpful. But unfortunately, that proves to be very unhealthy, as every drug has a potential side effect. So the causes of fibromyalgia really are driven by stress, and those that are more likely to get it tend to be one of two people. One is the type A, right? The doers. They do and 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 they do. And one day they're done out. So you could be one of those doers, these type A's who maybe you're female and you're still working if you can. A lot of fibromyalgia patients cannot. They've had to go on disability or give up their careers. But if you're still working, maybe, or this is how it all came, you were working 40 hours a week or more, and then you came home and you took care of the family. And then you went to PTA meetings and soccer games and the baseball games and all the things that go along with being a parent and all things that go along with being a spouse. And you just were a doer. You did whatever had to be done to take care of your family, or maybe work, or whatever your responsibilities were. But one day you just woke up and you were done out. You were done. You did and you did and did, and then you're done. You're exhausted. And now you start to see your sleep starts to become compromised, and you start to develop more and more pain and more fatigue, and more symptoms start to show up. Now, you could be a doer. So I take care of a lot of caregivers, a lot of doctors, nurses, counselors, people who are in the healthcare community, but you don't have to be a professional caregiver to develop fibromyalgia. But what I see in the caregivers, these are people that oftentimes have an elderly parent they take care of. Maybe they have a special need child that they take care of, but they're givers. They give and they give and they give. They give time to their church. They give time to different organizations. They're the person that their family, whether immediate or extended family, always turns to for advice and help. A lot of times we see that there's a lot of dysfunctional households where you've got kids maybe creating a lot of stress, unfortunately. And the person gives and gives and gives, and they give and they give. And then one day they've just given out. They can't give anymore. They've used up all their giving ability. And because of that, they have suffered all this stress, and now fibromyalgia has reared its ugly head. Fibromyalgia is largely due to a low pain threshold called allodynia. So those with fibromyalgia, their pain threshold is lower, so pain is magnified. And they have a thing called central sensitization, where the spinal cord, the nervous system communicating with the brain, is hypervigilant. It's overreacting, and it never turns off. So those with fibromyalgia have a pain system that's compromised. Instead of being able to turn on and turn off as it's supposed to, it never turns off. And what makes that even worse, as I just mentioned, because you have a thing called allodynia, your pain threshold is low, so pain's really magnified and it doesn't turn off. There's no drug that can correct that. Lyrica, gabapentin, pain medication, they can subdue it for a period of time, but there is a price to pay. For Lyrica, gabapentin, Neurontin, Grillis, these medications, which are supposed to be used for anti-seizure protocols, they are loaded with potential side effects, including, ironically, diffuse achy pain, nerve pain, poor sleep, anxiety, depression, brain fog, which is, unfortunately, we hear that a lot in the fibromyalgia community. But these medications are not really that helpful for fibromyalgia. We see that about 30% of people who have been prescribed it are able to stay on it because of the side effects. There's so many potential side effects. And the 30% that can stay on it, of those, minority actually show any benefit. Oftentimes what happens with fibromyalgia is you're taking so many different drugs from doctors who want to be they're well-intentioned, they want to help you, and they don't know what else to do. So every time you go back, and you do that a few times, they want to help you, they give you another drug. Or you get referred out to another practitioner or specialist, and he or she gives you another drug. And then you get to the point you really don't know, is the drugs I'm taking, are they helping or not? Because, some days you might have a good day, and most days you have bad days, right? I mean, it's kind of how I've seen it with my patients over the years. And you don't really know, but you don't want to stop any of the medications because your doctor recommended them and they're the expert, and you want some relief somehow, some way. You deserve it, right? But look at the side effects, the potential side effects of the medications you're taking. In fact, I want to encourage you, as your homework, is to look at go online and look at Mayo or wherever you choose to look at the potential side effects of every drug you're taking to see, is that something that could be affecting your health right now? What I find a lot of times is that my patients, initially at least, when we start working together, are taking medications that actually mirror the symptoms of fibromyalgia, and they don't even realize it. They just associate these symptoms that they have, whether it's pain, fatigue, irritable bowel, tingling in their hands and feet, they associate that with their fibromyalgia, when in fact, some of those symptoms, warning signs, are coming from the fact that the medications they're using, trying to suppress their fibromyalgia, common fibromyalgia symptoms, are actually causing side effects and creating more symptoms. Now, I'm not anti-drug. There's a time, there's a place, but in fibromyalgia, you just can't drug your way out of fibromyalgia. I want to encourage you to learn more about how you can overcome fibromyalgia. I put together a free report, and you can check it out at fibronow.com, and you can see the beginning of how you start to get your life back. In the conventional medical world, and even in functional medicine, the way that I practice and have for over 2 decades, and what I teach my practitioners who want to learn my protocols on fibromyalgia, we know that finding and fixing the underlying causes is the key. There's some common causes, and there's some proven therapies, protocols that have helped me help thousands of patients over the last 2 decades, and will be very beneficial for you as well. So check out that free report at Fibronow, fibronow.com.